Okay, let's talk about this effective renal plasma flow. In effective renal plasma flow, renal plasma flow can be estimated using para-amino hyperic acid PAH clearance. Again, the effective renal plasma flow can be calculated by PAH clearance. Between filtration and secretion, there is nearly complete excretion. So there's a complete excretion of all PAH that enters the kidney. So effective renal plasma flow equals the urine concentration of PAH times the V, which is the urine flow rate of PAH, divided by P. P is for, where is it? Okay, yeah, it's right there. P is for the plasma concentration of that. Plasma concentration of pH equals the C. The C is the clearance of pH. Okay, so that's just the math thing. So renal blood flow equals. So what is the renal blood flow equal now? Renal blood flow equals renal plasma flow divided by 1 minus hematocrit, usually 20-25% of choric output. PF, renal plasma flow, underestimates true renal plasma flow. So renal plasma flow underestimates the actual renal plasma flow. So when we look at pH, look here. It comes from the efferent arterioles, and 20% of gets filtered through the PT. So 20% comes here, and 80% gets from the blood, gets secreted into the tubules. That is totaling up to 100% of clearance of PAH. So as far as the definition goes, what it is, what is the renal plasma flow? It is the plasma flow that is going into the glomerulus, right? So renal plasma flow is the volume of plasma going into the kidney per unit time. So volume of plasma that goes into kidney per unit time. Okay. And one more thing is this: PAH is a carrier-mediated transport. So it can't, whenever you have the carriers can saturate, and when they're saturated can cause, so can get saturated. So carrier-mediated transport, so it can get saturated. That's all for the effective renal plasma flow.